Let's now discuss some of the knobology regarding the Logic E system. There are several buttons that are standard on ultrasound equipment, and there are some that are unique to this machine, and I will illustrate those for you. Like any electronic equipment, of course, you're going to have an on and off button, and this is what you use to power the machine on and off. We also will talk about several different things, and I'll just go through these in order. I will first discuss with you with the gain. So in this particular case, I've chosen to use the knee of the model because there are several good structures to look at the knee. You have, of course, skin, you have tendons, and you have bone. And in some individuals, like her, in normals, you might see a small amount of fluid that represents a small amount of bursal collection. Using the gain button, you actually can change how bright you're able to make your image. So using the button here, which is called gain, I would actually turn the image up to its maximal level, and you can see how white the image becomes. Then I will begin to turn it down to a point where I don't see as much of a white signal. And a rule of thumb is when you're performing your ultrasound scan, use the bone as your landmark, as your ruler. You should not see much signal or any signal below the bone because the sound waves do not penetrate the bone. If you're seeing signals that are going below the bone, that means your gain is too high. Let's first also talk about what else to do other than the gain is actually looking at the depth. When you have a deeper structure, for example, the knee, you might want to perform looking at structures like, in this case, the femur, as I go down further and looking at the patella. Well, if I want to get deeper into that area and make sure, let's say if for a larger person who has a thicker knee, to be able to perform an adequate scan, I want to be able to change my depth, which allows me to zoom. So let's say, for example, here, this is my portion of my quadriceps tendon. I have a small amount of physiologic fluid here just above the femur. Let's focus in on that area by using my depth and my zoom button, which is to the right of the machine. And with a couple of clicks of the machine, we're able to get to its maximal focus. One of the unique things about the ultrasound, as you can see, that the limit of resolution is pretty low, that you can actually get to the level of millimeters to be able to see the detail. In this case, for example, looking at almost the individual strands of the collagen fibrils involving the quadriceps tendon. As I told you on her, she has a small amount of physiologic fluid that runs in this area here, but there's no other bony pathology. So changing the depth of the zoom button, and then I will just go the opposite way to get back to a level, and I'm able to maximize that out. To get an idea about where you are, you can actually use the markings on the machine, and these are in increments of centimeters. So again, in this individual, I'm not looking at structures that are 3 centimeters, that's over 6 inches, so there's not going to be any signal there. So you really want to maximize the field based on your area of interest. So I tell physicians as I'm instructing them, don't be afraid to use the buttons to get an idea about what controls you have and what you may do with those. Let's take again my quadriceps tendon in the area of the femur. And if I want to focus in on this area, I also want to make sure that the maximal beam of my ultrasound is concentrated in that region. And this is where you can use the focal points. At the top of the Logic E system, you have a series of buttons. And this point over to the right, button 5, is a focus position, a focus number. If I depress that button, I can actually change the focus number, here going from 2, going to 3, or going to 4 hatch marks. I usually like to have it at 2 and use the area in between that to focus my area of interest. If I push that white button again, it highlights a focus position, and now I may change that position up or down to get the maximal area of interest. So again, I'm not interested in anything below here. There's actually no structures there. I want to have my focal points here, and I just adjust the focal point positions to give me that desired level. One of the key things for rheumatologists is going to look for areas of low blood flow in using the doppler. Let's say if you have a patient who has rheumatoid arthritis, a thickened synovium that has an increased blood supply there, you should be able to pick that up very easily using a doppler signal. I'll just demonstrate that on the machine. We have a series of buttons. Of course, the B mode is going to be your standard gray mode. But then the power Doppler is going to be the area that you would want to use to highlight, see if there's any areas of low blood flow. Remember that the Doppler essentially picks up motion. So if I move this, you can see there is some background motion. So the image, the Doppler should not have any signal when your hand is stable. And one of the things I usually recommend to examiners is actually to turn the gain up to its maximal point, and you will see that the image becomes completely red and blacken out. Blacks out the anatomy. And then what you can do is turn that image down to essentially have no noise at all. And that way you know you have no background signal. So if she had rheumatoid arthritis and this was a thickened synovium, that area would light up very brightly, indicating blood flow. And then finally, one of the other things you can do is actually doing areas of measurements. I'll just take this example here, but say, for example, I want to measure the thickness of her quadriceps tendon. You can freeze this screen using the freeze button, and then there's a button here called the measure button. And then once you can move the ball to locate your cursor, let's say if I have it at the inferior portion of the quadriceps tendon, I hit my set point and then rotate the ball up. And as that ball goes up, you can see that the thickness or the depth marker goes up, 0.7 centimeters. And I will go down here to measure the thickness of a quadriceps tendon, 0.24 centimeters. This is a very useful tool. Let's say if you have someone with rheumatoid arthritis, you want to measure synovial thickening, you can do a baseline and do a follow-up evaluation on those patients as well. And finally, other areas of measurements and of interest that can be obtained on the machine as well. Color flow, for example, if you're looking at the area of the posterior knee, for example, patients who might have a Baker cyst, to avoid the blood vessels in an area, color flow can look at both arterial and venous blood flow. The Logic system also has a feature called the Logic View, where you can actually scan the entire length of the quadriceps tendon, the patella tendon, or even the median nerve. And these are some of the unique characteristics of the Logic E system that has really made a significant impact on my ability to perform ultrasound evaluations of my patients in rheumatology.